In this short video, we will address the question, what is flow cytometry? Flow cytometry is a technology used to characterize different cellular populations in a mixture of cells. This technology is often used in the diagnosis and classification of hematopoietic neoplasms. With flow cytometry, we use the ability of cells to scatter light in order to measure physical properties of a cell, such as cell size or cytoplasmic granularity, and as well, we can use flow cytometry to detect antigens expressed either in or on a cell by staining a mixture of cells with fluorescently labeled antibodies and then looking for expression of the antigens to which they bind. A variety of sample types can be appropriate for flow cytometry, but for clinical flow cytometry, it's important that samples are sent to the laboratory fresh, ideally within 24 hours of collection. If a sample is going to take time to reach the laboratory, it's useful to submit it in a nutrient media, such as rPMI, but it's critical that samples for clinical flow cytometry not be placed in any sort of fixative solution, such as formalin. Flow cytometry does require that cells are in a liquid suspension, so a variety of liquid samples may be appropriate for flow cytometry, and they include things like blood, bone marrow aspirate samples, or a variety of body fluids, things like CSF, ascites fluid, or pleural fluid, for instance. In addition to samples that start as liquid samples, solid samples can be used for flow cytometry if you disaggregate them or chop them up and suspend them in fluid. And using this technique, we can do flow cytometry on solid samples, such as lymph node tissue, or a variety of other solid tissue biopsies. All right, let's talk a little bit now about how flow cytometry works. As I mentioned, flow cytometry can give you a sense of various physical properties of a cell. With flow cytometry, we can get, for instance, a sense of cellular size, and as well, a sense of the complexity of a cell or cytoplasmic granularity of the cell. In order to do this, flow cytometry harnesses the ability of a cell to scatter light. So let's consider an example of how this works. Now in the center of your screen, you have a cell, which is shown in gray, and has various antigens expressed on the surface, some orange and some blue. For flow cytometry, we'll start by shining a light on the cell, typically in the form of a laser. And as that light hits the cell, it's deflected in different directions. The light coming directly in front of the cell is known as forward scatter. And forward scatter will give you a sense of the size of the cell. The light that's then deflected at an angle from the cell is known as side scatter, and this gives you a sense of cellular complexity or granularity. Side scatter is increased in cells that have more cytoplasm and more granular cytoplasm. Now, in addition to measuring physical properties of a cell with flow cytometry, we can also use this technology to look at what markers are expressed on the surface of a cell. Different cells will express characteristic markers, these are known as antigens, and the pattern of antigen expression of a cell is known as the cell's immunophenotype. Antigens can be detected by applying antibodies to the surface of cell, and flow cytometry can be used to determine the immunophenotype of a cell by staining that cell with antibodies associated with fluorescently labeled tags. Let's go back to our gray cell, which has a couple of different antigens on it. We have 4 orange antigens and 2 blue. If we apply antibodies that are tagged to fluorescent labels to the cell, we will then stain the cell with a variety of antibodies. So here we'll have 4 orange antibodies attaching to the orange antigen and 2 blue antibodies attaching to the blue antigen. We can then measure the expression of these different markers on the cell surface, and that will be recorded as fluorescence, which will be bright for the orange marker as we have 4 antibodies bound, and will be relatively dim for the blue markers. The intensity of the fluorescent signal that you see is going to depend on the antigen density on the individual cell. Now, using the method outlined on the prior slide, we can determine the immunophenotype of various cells. And immunophenotyping is a cornerstone of diagnosing and characterizing a variety of hematopoietic neoplasms. Antigen expression is quite well characterized for hematopoietic populations, both normal and abnormal populations. So we have characteristic immunophenotypes that we see with normal maturation and in states of disease. Several examples of antigens that are evaluated by flow cytometry when considering a hematopoietic neoplasm are shown on the plot here on the right side of your screen, and they include markers of immaturity, which might be expressed, for instance, in acute leukemia, myeloid markers, and markers of B, T, or NK cell lymphoid differentiation. Again, immunophenotyping is a critical part of characterizing hematopoietic neoplasms, and this is a place where flow cytometry is used very frequently. Okay, let's take a look at how this works in practice. We'll typically start with an unstained sample composed of a mixed population of cells. We'll then stain that sample with a variety of different antibodies. In this case, we've used 3 antibodies, one tagged to an orange label, one tagged to a blue label, and one tagged to a green label. In addition to the variety of singly stained cells that we have, orange, blue, and green, we also have 4 cells present that are doubly stained with both the orange and the blue marker. We'll then take this sample and run it through a flow cell in a single file fashion. So let's consider the path of the orange cell. This orange cell is exposed to a laser. That laser light is scattered in the forward direction, and that's captured as forward scatter. Again, that gives us a sense of cell size. We also have light deflected at an angle, which gives us our side scatter, giving us a sense of cellular granularity or complexity. As a cell is orange, we'll be able to record an orange signal, but our blue detector and green detector will show no signal. So this will be a cell which has only the orange marker expressed with no blue or green signal present. Let's now extend that schematic representation even further. We're taking our stained sample of cells and combining it with something called sheath fluid, which is an isotonic fluid that carries cells through a flow cytometer in a single cell fashion, single file fashion. As the cells go through the flow cytometer, a laser light is shined on them, and the light that carries through as forward scatter is detected. Similarly, the light which is deflected comes to the side scatter detector and is detected. We have light from various detectors for the different colors of the antigens or the antibodies that are staining different antigens on the cells, which is collected on various detectors. And all of this information goes then from the detector to an electronic system, which converts the data that's been collected into something that can be read on a 2-dimensional dot plot, such as this one. Okay, let's take a closer look at this 2-dimensional dot plot. With these dot plots, we typically have 2 axes represented. In this particular plot, we have a blue axis and an orange axis. Each dot that you see on the plot represents an individual cell. And expression along these axes increases as you move away from the base. So things that are close to the base of both axes will be negative for the orange and blue parameter, whereas cells that are present higher along the y-axis will be positive for the blue parameter, while cells higher along the axis, the x-axis will be positive for the orange parameter. So let's take a look at the different cells that are present here. We have 2 green cells, and these are at the base of both the blue and orange axes and are negative for both these parameters. Contrasting with that, we have 2 events that are present in blue. They are, as expected, high intensity along the blue axis, but are negative for the orange marker. We have a significant proportion of cells here in orange. These are high along the x-axis, indicating positivity for the orange marker, and are negative along the blue axis. And then finally, we have a population of cells which are double stained with both the blue and the orange marker, and you can see them in the upper right-hand corner, indicating expression of both the blue and orange markers. Note the intensity of both blue and orange markers is lower for this population of double stained cells than for the singly stained blue or orange cells.
All right, let's move now from a schematic representation to an example from real life. Many of the samples in practice that we evaluate by flow cytometry for involvement by a hematopoietic neoplasm are going to be relatively complex samples. Consider, for example, peripheral blood or bone marrow, in which you'll have a number of different normal white blood cell types present. A good starting point to identify your population of interest is often a plot of CD45 versus side scatter. And to the left, I have an example of a bone marrow aspirate showing a plot of CD45 versus side scatter. Now this is a normal bone marrow, and using 45 and side scatter, we can differentiate a variety of different cellular populations. CD45 is a marker expressed with increasing intensity on hematopoietic cells as they mature. So the more 45, the more mature your cell will be. Side scatter, as you may recall, is increased in cells that have a more complex or granular cytoplasm, so the higher the side scatter, the more granular the cytoplasm of your cell. Let's look at the various populations we see present in this normal bone marrow sample. We'll start with the lymphocytes. These are shown in blue. Our lymphocytes are relatively small cells with scant cytoplasm, and they're mature. Because they're mature, they have a high level of CD45, and because they have very little cytoplasm and very few granules in that cytoplasm, they have a low side scatter. These can be contrasted with our granulocytic cells. Now, granulocytic cells have a very high level of side scatter, reflecting the heavy granulation often present in their cytoplasm. When it comes to level of maturation, the granulocytic cells that you'll see in the bone marrow range from less mature cells, such as promyelocytes, to more mature cells, such as neutrophils. So the level of CD45 you'll see in granulocytic populations in the marrow varies, with neutrophils having the higher level of CD45 than your promyelocytes. Now between the lymphocytes and granulocytic cells shown in pink, this is the region that the monocytes will fall out. They have high CD45 as their mature cells and intermediate side scatter. Finally, I'll point out our blast populations or our progenitor populations. They're shown in aqua and red. In red, we have our myeloid blasts. These cells have low CD45 and will have intermediate side scatter. And in aqua, we have our hematogones or B cell precursors. These have low CD45 and they have relatively low side scatter, a level of side scatter similar to the mature lymphocytes sitting right above them.
Now, the population on which we focus is going to depend somewhat on the diagnosis which we suspect. For instance, if you're concerned about an acute leukemia, your greatest concern is going to be the immature cells or blasts. So you might focus your attention on the blast region on a plot of CD45 versus side scatter. If by contrast your concern is of a lymphoma, you might be most concerned about the region occupied by mature lymphoid cells, so you might start by drawing a gate around the lymphocyte region. In this case, let's take a look at an example of a gate drawn around the lymphocyte region, and look here at a plot on all lymphocytes of two parameters, CD38, in this case, an activation marker represented on the y-axis, and CD56, a marker of NK cells represented on the x-axis. Remember, each dot that you see on one of these plots represents a single cell. And we can see here 4 different populations. The population which is most abundant in this lymphocyte gate is one here which is negative for both CD38 and CD56. We also have a smaller population which is positive for CD38 without CD56. Another relatively small population positive for CD56 without CD38. And finally, a relatively large population positive for the markers CD38 and CD56 both.
As we come to the end of this video, I'd like to leave you with a few take-home points. As you've seen, flow cytometry is a tool used to characterize the immunophenotype or pattern of antigen expression of a population of hematopoietic cells. It's typically performed on fresh specimens, and it is a critical part of both diagnosis and classification of the hematopoietic neoplasms. Thank you for your attention. To learn more, visit the ICCS website for additional resources about flow cytometry. Thank you for your attention.